Hey, I figured I would post this really quick. As you can see, I'm in a medical setting. I'm going to be going into back surgery here in a little bit. I'm waiting to get my IV. I even shaved my arm so that I didn't rip out as much. Anyways, I just want to let you guys know, it is Jason's birthday today. So I gave him one part of his gift so far, but he is sitting out there waiting on me because this is a kind of an outpatient kind of thing. Inpatient, well, it's not inpatient, it's outpatient. So they're gonna put me to sleep, do a bunch of shit to my back, and then I'll be out of commission for about 5 days. But other than that, it's kind of an in and out procedure. They've come a long way in medicine.
How you feeling? You feeling okay?
Hard to focus, but I'm good.
I'm gonna fix this on your finger real quick, okay?
Yeah, they usually use my middle finger because all my other fingers are small. The joys of having a ring finger that's a size 4.
Now, what's your pain level right now on a scale of 1 to 10?
Well, my migraine is less. I can actually see out of my left eye now.
Good.
My lower back. So far, it's numb.
Okay.
And I dropped my hair tie behind the wheelchair.
Oh, I'll grab it for you. Here you go.
Thank you.
You're welcome.
Even with trying to use flat irons and stuff,
Yep.
I have a mild curled pattern, and it seems to want to fro. Nowhere near what Jason missed, but he's got such beautiful colors. And he was able to do something for my brain, so hopefully that damn migraine goes away, because I'm out of one of my medications, the Ubrelvy.
Okay, let's check.
It's not something you guys provide.
Oh, okay.
I could have swore I put it in here. Oh, stop it. I know I'm moving. I really can't. I could have swore I put it in here.
Really quick, okay?
She left actually a corner over here. But I shaved my arm here, so it made it a whole lot easier.
There we go.
What each needle is that? It looks like a 24, or I mean a 22.
It's a 22.
Did I wake up easier this time?
Yes, you did.
Yay. I warned him about the fact that I was slow to wake up last time. Yep, I'm losing my mind. I could have swore that I put my Ubrelvy in here because that was literally the last pill that I had. Okay, I need to quit moving. The machine is mad at me. Can you also make sure that Dr. G does my refills, because when I was here a couple weeks ago, he did not send those over. Also, the insurance told me last Friday all meds need to be a pre-auth, even though they're being retarded. They don't want to pay for my meds, so.
that date of birth for me?
9/27/1980.
There's that, and your appointment card, okay?
Hey.
We're gonna get you on downstairs.
And also the baclofen and the that's one of the words. The baclofen and the difloconate did not get refilled, even though Dr. G did send them over. For whatever reason, Publix didn't get them. So if you
need to
could,
resend it again?
yes, please. The difloconate.
Alright, I'm gonna have to send them over to the pharmacy, okay?
Thank you, Mo. Hey, did you ever finish that application for live ops for the
Yeah,
position?
I was actually going to text you because I was going to send in another one, and then my mom is back from California, so I was going to.
If you want to do Nike and work for Nike like I do, please let me know. I can send in a good word for your application for the ARAs and the program director to see. It's super easy. I can train you myself.
Oh yeah, I'll text you because we might be getting out of here early, so I'll text you and then you'll
And
have
it's
it.
something you can do nights and weekends because we're open until 2 a.m. It's from 7 a.m. to 2 a.m. I am telling you, Nike is the easiest line to work for. You're basically just dealing with where's my shit.
Yeah.
And okay, so out of surgery already. It's been a couple hours. I recorded the other bit and then they took me right back. So IV name thing. So yeah, we stopped at Wendy's to get food because I prefer Wendy's over McDonald's, and I certainly am never fucking eating Burger King again for the rest of my life because their food is trash. Anyways, so not only did they do the middle and lower part of my back, they also did nerve blocking on this side of my head. So I have literally, if I do this, I tried to clean up some of it. So it's right in here. So anyways, oh, and this is the color. I only colored the top of my hair because again, the rest of my hair is for donation. So here is the color. The green did not come out as vibrant as I wanted it to. The purple kind of took over from the root because I did the root as a dark purple, and then this you can kind of see the green hue to it, but because I had done some filler color with some 4A and 4N like 3 months ago, the base brown color is still like stuck in there. Here's Jason, it's his birthday today. Anyways, so yeah, so they did put some injections in my brain as well as my back and stuff, so we'll see how this goes. And I let the anesthesiologist know that it did take me a while to wake up last time, and he did a really good job of using less of the... What are you doing with the... He's done running off with the nuggies. He's put it all underneath. You might want to push the number 2 button on the door, dear.
I did.
There's no way. Put your wrist forward. Let me show you a test. Put your hands all the way forward.
I already hit 2 already. They had already moved it.
Did it?
Yeah.
Because it looks like you're way too close because your knees should not be touching the dashboard. Put your hands forward like this.
I know. I know all that. I know all that.
Okay. You're just really close to the dashboard. If we get into a wreck, it's going to break your knees.
Well, that is what it is.
Anyways, so, yep. So they did my head. So far, the migraine pain that I had earlier, I can still feel part of it, and it's messing up my sinuses. But other than that, so far, I mean, I can feel where they did the injection and stuff. But there's a pretty Mercedes right there. Anyways, so I will see you guys later. Okay, so we just got home, and I just realized you can see where I had the oxygen in my nose, but I figured I'd show you. This is a pair of like leggings
that has this like weird skirt thing over it, and it's got detailing on the legs, and of course I'm wearing my Irish socks. So this was the outfit, and of course my shirt was tucked in, but I'd never be able to wear a damn mini skirt. But you think I went from 131 pounds to 205, and I'm down to 148. So I think losing all that weight, granted I still got to keep the girls, which are quite nice, but other than this like little bit, I've lost most of that weight. I have a little bit of issue with these, but we do have a membership to a gym. Oh, and I haven't even seen my back, so I guess I could do this because I have not seen my back, and this will be the easiest way for me to look at it. But yes, I'm still working on this. I even brought my own gauze pads because I told them, I said, look, I had an allergic reaction to your Band-Aids because I had welts for like 2 weeks on my neck. And then they did, and also it's funny, when I did my last recording, like I can do this, but like right about here is where I feel the numbing, and I've got a huge bump right here on my head. So I can definitely feel on both sides of my head where he put it. But when I first got in the car, it was still painful. So I know that the numbing hadn't like really taken effect yet, which is kind of funny. But anyways, so yes, like from here back is kind of numb. Now the spots where he did the injections, I do have blood in my hair, which I just washed my hair not yesterday, the day before. So I kind of knew that that was going to happen. But because my hair is clean, I'm fine with it. And of course, I still have this. That has to stay on for a couple of hours, but I can take this off. You know. The dog likes to play with these anyways. Also, Jack loves to play with these. And I got to explain to somebody today about what fibromyalgia is. So that was kind of nice. And yes, I normally don't put my shoes on the counter because ew, but this counter is disgusting and needs to be washed anyways. But I've had a migraine going on for so long that honestly, it's been hard for me to clean. Like I got one toilet cleaned and then the chemicals made me really sick. And I was like, okay, I can't do this. Plus leaning over made my head hurt really bad. So I was like, yeah, I gotta wait to do that. For those that don't know, I have a chronic migraine condition that's called a cyclical migraine condition, and it screws with my brain. So some days I can function and some days I can't. And just to show you, I brought all my meds with me. So this is Furacet or butylbulb acetate. This is the one with 50 milligrams of caffeine, 30 milligrams of acetaminophen, and 40 milligrams of CAP. This is the Nurtec ODT, which kind of works sometimes. And then this is the other one they give me, which is Ubrelvy. This is a 100 milligram tab. And then if those don't work, I have these. So this one is metoclopramide. This is 10 milligrams. It's called Reglan. This one here is Ketorolac. It's 10 milligrams. And this one here is ondansetron, which is 8 milligrams. These are my emergency meds. This is like an IV, but in pill form, and you take all three at once. So one of them causes like horrible stomach cramps and vomiting and nausea. One of them is like a pain reliever. This one here says take 1 tablet by mouth 1 time a day with the other 2. This one here says it causes dizziness. This one says take with food. Even with like food and water, oh my god, one of these is like fucking horrible. So I take just to show you, a lot of meds. They're too deep. I also have the magnesium glycinate that I take, my B complex, my L-arginine, those are Jason's things, the melatonin, my turmeric and curcumin, which I'm almost out of, and then this is the hair, skin, and nails gummies that I use. I also have ginger root that I take to help with migraines. So I take a lot of different meds, as you can see. So we got 2, 4, 6, 8 are the ones that I take on a regular basis, and then of course my migraine stuff. But yeah, so I live in chronic daily pain. So these injections are helping some. They're trying to avoid doing open back surgery on me, which is what I requested, is to try and avoid open back surgery because I don't want to be paralyzed. So anyways, I will see you guys later. I'm going to put my PJ top back on and get out of this bra because having a 34H bra on is very painful, no matter if it's just padding or not. This one here doesn't have like padding, it just has the cup shape, but there's underwire in it, and because my breasts are so heavy now, it like pulls and so then the wire digs into my chest. My other bra, just to give you an idea of cup size here, it's big enough to be a yarmulke. This one here doesn't have like the wire here. It's just like the cup, and there's no padding in these at all. Nothing. No padding. It's just a layer of fabric. So this, yes. So gaining the weight gave me a nice rack, but these motherfuckers are heavy. So I don't wear a bra normally because the bra actually makes them even heavier, which when I let them like out and be free and stuff, it's much easier for me to breathe. So anyways, I'm gonna go. I will see you guys later. I'm gonna get my shirt on and go give Jason his birthday gifts because I only gave him one sticker so far, which was a D&D sticker. It says, if the DM is smiling, you should be worried, which is pretty accurate, especially for D&D. Anyways, I'll see you guys later. Bye.